Every hospital runs on beds, and on a busy morning, the hardest question is a simple one. Where is the next bed coming from? Bed management decision support in MasterCare PAS is built to answer that at a glance. Let us take a look. This is the bed board, one live view of every bed in the hospital. Across the top, the numbers your flow team needs are always in front of them. Total beds, how many are occupied, and the occupancy rate, what is available right now, what is reserved, and what is sitting dirty waiting on a clean. Down the side you can jump straight to any ward, from ICU and emergency through to your surgical, medical, maternity and orthopaedic wards. Every bed is colour-coded by status, so occupied, available, reserved, dirty and on leave, all read instantly, and the acuity of each patient sits right there on the card. Filter by status or search for a patient or a bed, and the whole board responds at once. The board is not just a picture, it is where the work gets done. Select any bed and you have the full patient detail in one place, their ward and room, admission and estimated discharge, specialty, nursing acuity, and any alerts and allergies, flagged clearly at the top. From here you drive the whole bed life cycle without leaving the screen. Allocate an available bed to a waiting patient. Transfer or even swap patients between beds with acuity and history following them automatically. Set a discharge date or discharge a patient, which notifies the coding module and flips the bed to dirty ready for housekeeping. Every action is confirmed on screen, so nothing is left to guesswork. Where the platform really moves from tracking to decision support is demand and flow. Discharge confidence scores every likely discharge as high, medium or low and names the blocker holding it up, whether that is a step-down bed, a specialist review or a rehab placement, so your team can clear the obstacles today rather than discover them at 4 o'clock. Alongside it, the admission waitlist shows who is waiting, for how long and how urgently. Then there is the 7-day bed demand forecast, projecting occupancy for every ward across the week, with wards heading past 80% flagged in red before the pressure hits. And bed turnaround is measured against target for each ward, so a ward running well over its clean time target stands out immediately. Beds are only half the story. The nursing view turns your bed data into a real staffing picture. Because every patient carries an acuity level, PAS calculates the required nursing hours ward by ward, compares it to who is actually rostered, and shows you the gap and the wards at risk in a single traffic light. Choose the shift, plan forward to include reserved beds, and look ahead with the 7-day staffing projection, where anything more than 15% under required is flagged red well in advance. And when your rosters change, set staffing lets you enter the real numbers and updates the whole projection instantly. The alerts view brings the priorities to you. Active alerts surface the things that need eyes now: an ED backup, a discharge at risk, a turnaround breach, a step-down bed not yet secured. But the standout is key decisions requiring attention, which does not just raise a flag, it recommends the next action. Escalate the ED backup. Resolve a discharge blocker before it pushes length of stay past the trim point. Secure a step-down bed before a planned discharge. That is the decision support your bed managers can act on straight away. And when the shift ends, the handover view pulls it all together into a clean isobar handover sheet in a single click. Pick the ward, the shift and the date, add the outgoing and incoming nurses, and PAS produces a printable summary with census, acuity, and nursing requirement, every patient's alerts, precautions, plan and disposition, plus space for handover notes and signatures. One button and a consistent, professional handover every time. That is bed management decision support in MasterCare PAS. One live view of every bed, forecasting and staffing insight that looks days ahead, clear recommended actions, and a one-click handover, all designed to help you use your capacity better and keep patients moving safely through the hospital. To see it running with your own wards, talk to your Global Health Account Manager. Thanks for watching. MasterCare, Australian owned and operated.